Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. It's been a very busy June for the NAAOP Fellows, Alicia Carver and Susanna Egdahl. We've just returned from Capitol Hill, where we've been promoting and lobbying on the Medicare Orthotic and Prosthetic Patient-Centered Care Act. We're getting a good reception to the bill, and we're working closely with AOPA and with the O&P Alliance members to try to promote the legislation and ultimately to get the bill introduced as soon as possible. We're working in a bipartisan way. We met with a number of members and their staffs today from the Ways and Means and Energy and Commerce committees, and both Alicia and Susanna have plans throughout July to try to meet with as many members of the Energy and Commerce, Ways and Means committees, and the Finance Committee in the Senate to promote the legislation and to build as much co-sponsorship and support as possible. Again, we're working closely and in connection with AOPA, which is taking the lead on the legislation itself. Some of the provisions in the bill are receiving some very significant support and initial enthusiasm, including separation of durable medical equipment from orthotics and prosthetics from a regulatory perspective, making sure that CMS is not continually trying to fit a square peg into a round hole. Number two would be limiting the expansion of competitive bidding and to restore congressional intent in terms of the meaning or the definition of minimal self-adjustment, which defines off-the-shelf orthotics. This is a term that unfortunately compromises the clinical care that will be connected with orthoses under that program, and that seems to be getting some traction with the people we're speaking with. That's a coster to the federal government, and so we've put forward a saver, a proposal that would save the government money, and that is in the form of a ban on drop shipping of orthotics to patients' homes. That's definitely a proposal that seems to be getting some traction in the wake of the $1.7 billion fraud and abuse announcement by the Department of Justice 2 months ago. And finally, trying to get orthotists to be treated the same as physicians and therapists when providing orthotic care. There's no reason why a patient should have to go to 2 different providers to get an off-the-shelf orthosis and a custom orthosis on perhaps another limb when they can simply go to one. Just because an orthotist doesn't have a competitive bidding contract shouldn't mean that they're banned from providing care to patients. And ultimately, they would be reimbursed at that competitive bidding level anyway. And we feel that this is a non-costing, patient-friendly provision. So we'll continue to keep you informed as developments occur, but we're all making great progress on that legislation. So now on to the reports from the fellows. Suzanne.
So June was a very busy travel month for Alicia and myself. Back in the beginning of June, we went up to Lansing, Michigan to visit the Stacosa Prosthetics Clinic. We spent several days there touring the facility and watching as the prosthetists met with patients, and got to see some of the fabrication processes behind the scenes, which was interesting for both of us as patients, getting to see a different perspective on those things. We also had a chance to chat with some of the administrative staff there and learn about procedures they use with electronic medical record keeping. And that was a really nice complement to the next trip we took down to Florida to visit OP Software. So we got to see the software used in practice at the clinic, but talking to the folks down at OP and learning about how they work together to make that software possible, and just talking a lot about the importance of record keeping to the profession and documenting those outcomes. We had some great conversations and learned a lot. Earlier this week we were out in Iowa, in Waterloo, visiting OPGA, and that was a great experience as well. We learned about how OPGA works to support independent practitioners from a business management perspective. So all those trips very nicely complemented each other. The final thing that I'd like to comment on is when we were up in Michigan, we had the chance to spend a day at the state capitol and get a little bit of exposure to state-based advocacy, excuse me. So that was a nice compliment to our experience here on the federal level in DC.
Thanks so much. And Alicia?
As Susanna said, we've had a very busy but wonderful month, and as well as the ones that she had mentioned that we had visited, we have also visited BOC, the Academy, NCOPE, ABC. We will see AOPA tomorrow. And with all those organizations, we're really getting a chance to sit down with them, learn about their organizations, how they operate, their missions, what they do to add value to the O&P profession, and how they all work in unity to help advance the profession as a whole and help get some of these issues that we're dealing with in Capitol Hill and advance them forward. We will also, at the end of July, be guests at the Amputee Coalition National Conference. So we're very thankful for everybody that has put time into planning our visits, executing our visits, and really showing us a warm welcome to each of these organizations.
So thank you to all of our supporters for the program. Thank you to the supporters of NAAOP. Have a wonderful Independence Day.